The Ministry of Health denies it was ever asked for extra funding by a disability and rehabilitation service that says it's being forced to close its doors for largely financial reasons. Laura Fergusson Rehabilitation offers residential and outpatient care, including rehab programs for people living with disabilities and those affected by strokes, brain and spinal injury. But on Friday, Checkpoint revealed Laura Fergusson Rehab is closing all services in Whanganui, Waikato and Auckland, and that will happen by August. Board spokesperson Rob Small said the Trust asked the government for extra funding, but were told no.
The core problem is the current funding model is not adequate to meet our needs.
So in plain English, what, government contracts are not sufficient for you to cover the cost of the services you're offering?
For our business, yes.
Did you ask the government to give you more funding?
We've consistently asked the government to provide more funds for some of these services, and in some cases we haven't taken clients because we knew it would be unprofitable. And
what was their reaction? Did they give you any more money?
No.
But the Ministry of Health's Deputy Director General Disability, Audrey Isbister, says Laura Fergusson Rehabilitation did not ask them for extra help and only told them of the planned closure after the decision was already made.
We work with providers that come to us with different sustainability issues or any other issues that they might have, and that was an opportunity we didn't have here. As I said, we acknowledge that, and I suppose for the Ministry of Health, our real concern is for the residents, the disabled people, their families and whānau, and ensuring that they have the best possible service. So going forward, we want to ensure the transition is as smooth as possible.
So are you telling us that this came as a complete surprise to you?
It did.
There were no prior discussions about difficulties with their finances and funding?
No.
The Trust has told us that they asked you for more funding and that you said no. Is that not correct?
To the best of my knowledge, no.
Why would they say that?
I don't know. I can't talk on behalf of the Trust.
But you can talk on behalf of the Ministry. So when was
Yes.
the last time you had a conversation with Laura Fergusson about the level of funding they were receiving?
So in my time there has been no conversation with Laura Fergusson on the level of funding they were receiving.
So how long is that?
9 months.
So in 9 months they have not raised with you any issues around the level of funding that they're receiving?
No.
With nobody at the Ministry of Health at all?
Not that we've been able to confirm.
So when you did find out that the board had voted to shut up shop, you've given us a press statement that says that you work with the provider to explore all options for them to continuing offering services. So what options did you explore to keep Laura Fergusson Rehabilitation afloat?
So one of the things that we can do is, if something like this gets signalled by a provider, we can support them by bringing our finance team in, working with their finance team, looking at how we can think about future models of care. How do we support, how do we work with other providers in the same region, other funders? We're not the only funder for Laura Fergusson Trust. Yeah, so we look at a number of options.
Did you put your financial people in there? Did they take you up on that?
No, we were told once the decision had been made, so we did offer that though. Once we heard, we did say, hey, is there anything that we could do right now to change your mind? We met with their deputy chair and their board and the CE, and the decision had been made, and at that stage it was very much about how do we look forward into the future, and we enjoy a good relationship with Laura Fergusson Trust.
Well, how concerning is that for you then, if you did not know about this until the decision was made that they were in financial trouble? How do you know that some of your other providers aren't in the same position?
Well, we don't know, but we do work closely with the community, and we've been having a lot of conversations with providers, and we totally acknowledge that there are challenges working in any business, in any organisation, and so we have asked people to come to us with different conversations, suggestions, solutions. As I said, we're here for the people that we serve, which is the disabled person, their families and whānau.
So have any rehabilitation services put their hands up to say, hey, we've got financial problems since the Laura Fergusson issues come to light?
No.
So I ask you again, were you paying them enough for the contracts that they were providing?
I haven't got the level of detail on what the contract actually says. I do know that individuals that are in a community residential support service are funded on an individual basis depending on need, but I don't have the level of detail on the funding and what that was.
So how much was Laura Fergusson Rehabilitation getting from the Ministry of Health each year, ballpark?
I was under understanding it was something like 4.1 million, and we asked Laura Fergusson permission to be able to say that figure.
So about 4.1 million for assisting how many people?
They have a number of different people in different services, so some are the long-term residents, some are coming in and out of Laura Fergusson for respite care, some are coming in for other services like rehabilitation, and I don't have those figures on me of exactly how many people for what service.
But do you think that was enough money for the services that they were providing to cover costs?
Well, without going in and doing the financial work, I can't actually say whether or not it was, without having the detail in front of me.
Because obviously they have publicly stated, a board member has publicly stated that they asked you for more money, you said no, and that the money that you were paying them for the contracts they were providing was insufficient to cover costs. Are they not being upfront about that?
I do understand that this board member said that. I would be probably refer you back to the CEO and the interview there and the factors that she said contributed to the final business decision.
So, I'm sorry, I just wondering if you can be clear with me. Do you refute those statements made by the board?
That they had come to us asking for, yes. As I said, to the best of my knowledge, I haven't had anything to suggest that, no.
And then the other statement that you were paying insufficient funds to cover the basic services they were providing, is that a correct statement?
I don't know, because I don't know the actual funding per person. As I said, I know the bigger picture, the full amount, but I don't know what individual was attributed to how much funding. So without actually getting our finance team in and having a look at the detail, I wouldn't be able to say that.
Is the disability sector as a whole struggling with funding?
We know that the disability sector as a whole has been provided 72 million more per annum as of last budget. There is certainly a growth in the amount of people accessing services, and for providers there's a volumes issue there as well. Last year I went out to the community, to providers, to disabled people and their families and whānau, to talk about what it is that we can do to work together to ensure that we provide the very best service and contribution to their disability support, but what ideas that they might have that in terms of efficiencies and models of care. And we've had some amazing conversations, and we've had some really good suggestions, and I think that we will be making some headway in that respect.
If you went out to consult with the service providers last year and you had good conversations, did you go to Laura Fergusson as part of that consultation?
Yes, they were part of the community conversation.
There was no conversation then, or no inkling at that point that they were in trouble?
No.
And in a statement to Checkpoint this evening, Laura Fergusson Trust maintains it consistently asked Ministry of Health for additional funding for individual clients and contracts. Laura Fergusson received $8 million from ACC and the Ministry of Health in the last financial year.